Hi there, I'm going to take you through some knee and quad isometrics aimed at improving knee health and strength and preparing you for high loads that you might deal with in sport, exercise, or even just daily living. So if you have knee pain or instability, this will help you. Or if you just want to be stronger and more powerful, even just improving your lifts, this will also help. I'm going to take you through an example and then discuss how we can adjust it based on your needs and your goals. So first, what I'm going to do is I'm going to try to put a lot of force through my quad and knee. So if you have something to sit on, that's going to be very helpful, especially if you can grab it. So a bench, a chair, something like that. Weights are optional. Sometimes they can be helpful. What I'm going to do is I'm going to wind up my knee and ankle. I'm going to pull my foot below me if possible. I'm going to drive through the ball of my foot, okay? Starting slow, we always want to start slow. So I'm going to start pushing down into the ground. As I do that, my quad's going to fire up. I'm putting force through this knee, through this foot and ankle. As I gradually push harder into the ground, more force. I never want to push through pain, and I want to get to the greatest safe force I can, and then try to maintain that for about 10 seconds, all right? I'm not going to get to the greatest safe force, for me at least, just by pushing down. So once I push down as hard as I can, I'm going to start pulling into this bench, and this is the beauty of this setup. As I pull into it, I can even lean a little bit, and that allows me to create a much more intense contraction through my leg. I'm still driving through the floor. I'm pulling here. If I really want to, I can grab onto some weights, and that's going to help amplify the intensity as well. Okay? Then I would relax. I like to rest 30 seconds to a minute between reps. Do between 2 and 5 reps. If you're not used to this type of work, I'd recommend fewer reps. Now, what angle should you pick? Well, if you're an athlete, I would recommend working yourself into deep knee flexion if possible, but we don't necessarily want to start there because the more flexion you have and the more stretch there is on this quad, the more propensity there is for there to be pain or discomfort. So you want to start off maybe 90 degrees. See how that feels, how much force you can create, then gradually wind up into greater flexion. If you have discomfort or pain at any angle, what you can do is these isometrics just outside of that, maybe 10 degrees outside of that angle, okay? Or don't go as hard with the isometric. So let's say I have knee pain here, okay? Well, I want to see where can I push down that I don't have knee pain. Here? Oh, maybe I do. Okay, then I'd go here. And what I would do is I would gradually build up that intensity as high as I safely can and do a few reps there. And then maybe over the course of days or weeks, I would start to get closer and closer to that angle where I have pain or discomfort. And over time, you will start to gain greater access without pain. So this is great for rehab, also great for preparing your body for high forces. Because if you end up here and your body isn't prepared for maximal force, you could potentially get injured. So another thing that you can do is work on either end. So maybe doing a squat or a lunge, there's a specific angle at which you have pain or a sticking point. Let's say like right here, okay? You can specifically work that angle if you don't have pain to strengthen it so you can work through your sticking point more easily. Another thing that you can do is if the pain point is not at your end range, but it's in the middle, then you can work both sides of it, right? So let's say it hurts here. I'm going to work this angle, and I'm going to work before that angle. All right, so hopefully this gives you some ideas. Again, I'd recommend between 2 and 5 reps, 30 seconds to a minute in between. If you're a little unsure and you are dealing with some significant inflammation or knee pain at this time, or whenever you want to do it, then I would just say start lower intensity. So sometimes, personally, my knee hurts a little bit here. Okay, so what I might do is go, okay, I'm gonna go 20% effort. Awesome. All right, maybe I'll go a little bit more. So you can work any angle you possibly want to with lower intensity and see how that feels. Build it up over time. If you have no pain, no discomfort, you feel awesome, you just want to be as resistant to injury as possible, as strong, as powerful as possible, I would recommend working a lot of different angles, okay? But the angle at which you're going to be able to get the best leverage for this is really winding up there, like this, okay? You could even put a block or something under your foot to get more knee flexion, or you can change your body angle, okay? So try these out, let me know how they go, and don't forget to smile.